Hidradentis suppurativa, aka inverse acne. So this is a chronic as well as inflammatory, and it is a recurrent and debilitating follicular disease, and this is usually it is present after the puberty. Now moving ahead, they are very painful. They are deep seated inflamed lesions, and they are present in the apocrine gland and bearing areas of the body. They are most commonly present in the axillary as well as the inguinal and the anogenital regions. Next, moving ahead, the definitions that are based on the San Francisco modification of the Dessau criteria. So here the three criteria it must be met. First is the typical lesion. So in case of the typical lesion, it is deep seated and that is a painful nodules. It is blind boils as well as this presence of abscess. There is a draining sinus. There is presence of the bridged scars, and they can be the paired or the multi-headed open pseudocomedones. This is present in the secondary lesions. Next, what we see is a typical topography. Typical topography. In typical topography, the axillae, the groin, as well as the perineal and the perianal region, as well as the buttocks and the infra and the inframammary folds. Then we have the chronicity and the recurrence of lesions. So the most common is present in the women, and this is in the age of 20 to 29 years. And next you have the obesity as well as smoking. They are the two main factors. They are associated with the Hidradenitis suppurativa. Now looking at the treatment. The treatment, it includes the antibiotics. This includes the tetracycline as well as the clindamycin. Next, what we see is the intralesional corticosteroids. Then there is also the immunosuppressants, and there is the acitretin, anti-TNF alpha therapy, as well as they can be the surgical treatment.